We turn our attention now to Isabel Benitez and volunteers just like her at Lakeland Volunteers in Medicine. Isabel helps Lakeland Volunteers in Medicine take care of thousands of underserved and uninsured patients in Polk County. Because of community helpers, the charity has served more than 33,000 patients to date. Isabel joins us now from the busy clinic in Lakeland, along with Alice Kaler, who is President and CEO of Lakeland Volunteers in Medicine. Ladies, thank you so much for joining us.
Thank you for having us.
We know that you all are so busy. There are the two clinics. There's the Lakeland Center as well as the clinic in Bartow. So we knew that if we had you on Zoom, at least we would get you to join the show. Tell me about your volunteerism, Isabel, with LVIM.
Well, I love volunteering here. I started 8 years ago, and to me, it's just giving back to the community and showing my light, beaming out to others that need it. It's very important for me to come here once a week and just show my love, my light.
You do a couple of things for at the clinic. You're an escort for the patients when they come in, and I'm also told that you help them with Spanish translations. Tell us about that.
Yes, that to me is very important because medical literacy is very important. They need to know what is being told to them, or they don't have that. So that knowledge sometimes of the medical is very important. That's for me, that's like number one. And that makes me feel really good to be out there and have them understand when they leave the doors, the medicines they need to take and everything that is said to them.
One of the things, Alice, that I'd love for you to really highlight for our viewers is how important volunteers are to the operation of LVIM. You all have about 400 volunteers annually who serve in different areas.
Yeah, that's correct. So volunteers is in our name, and we take that to heart quite literally. We serve about 2,000 unique patients each year, and the bulk of that work is done by volunteers. We only have 22 full-time staff, so most of the care is provided by volunteers, but it's not only the doctors and the dentists, it's people like Isabel who make the magic happen and are the receptionists, and they process medical records and the schedulers and everything in between. So we volunteers this year so far have given more than 36,000 hours, and that translates into about $1.7 million in value. So if you think about, I know in a previous segment you're talking about, like, if you don't have a big check to write, there are other ways that can make a big impact. So if we didn't have the volunteers, we would need $1.7 million more to make the care happen for our patients.
And you don't have to be, you don't have to have a background in the health industry. You don't have to be a retired health professional to volunteer.
You do not. To be a doctor or a nurse, you do, but not to work in the office. Yeah.
Yes. There's different things that you could do that are non-medical, I guess, if you will. I mean, you can take in the patients, or answer the phone even. So there's a lot of stuff that it doesn't have to be medical background. There's always something to do. I came in doing one thing and I've done others. So it's fit your, if you have that heart, come in.
And so Isabel, for you, what has it been like volunteering? It seems like, you're surrounded by some really interesting volunteers, co-volunteers with you, as well as the patients that you meet. It's quite a great support system that you've made there as well.
It is. So it's not so much that I am giving to the community. When I come here, they give to me, the volunteers and the patients, and some patients, I come in on Thursday morning, so they know that I'm here, and they'll call, or so I made a great relationship, not so much with the patients, with the workers and the volunteers. It's been a great experience for me. As much as, giving back, I do take some also.
Alice, it seems like the volunteers are like superstars. Alice, you've told me about the different volunteers that you all have with you. There's the retired nurse who is from Kentucky, correct? She's been there, retired nurse, 30 years. and then some of the other volunteers as well. It's just amazing people.
Yes, they all have incredible stories. It's really fun to get to know everyone.
Yes.
I do think, our primary mission is to care for our patients, but we can't do that without our volunteers. And to watch the difference that our mission also makes in the lives of our volunteers is important.
That's true too. Yes.
We do have a lot of retired individuals, and sometimes when you retire, you don't know what to do, and some people get stuck at home, and that's not healthy. So to have a community that can give back to each other as well as to the community really helps with that aging in place. But then the other side is about 30 to 40% of our volunteers are also students. So we have this like intergenerational thing going on that's really fun. And the retired physicians are able to teach up and coming medical professionals, and it's a really cool thing that happens here.
Well, happy holidays to you both. Thank you so much for joining us and for helping us spread the news that, volunteering is really the best gift, not just for the recipient, but for the giver as well. To our audience, if you would like more information on more volunteer opportunities, please visit lvim.net. That's LVIM for Lakeland Volunteers in Medicine.